Still good morning? Yeah, good morning. Good morning, everybody. And thank you to Stephanie and her team for inviting me to share Waterbury School District's innovations in contemporary school nursing. I am the school nurse manager for the city of Waterbury. Now, I work for the health department in the city of Waterbury, which is actually, I've worked in both. For the Board of Education, I managed a school district in the past, and then I've worked here for the health department. And I have to tell you that everything I'm going to talk about today, my health director and assistant health director have been so supportive, and it's a lot easier to convince people who actually are in health about things we need to do in school nursing. So I'm very lucky that way. In the city of Waterbury, we have 40 public schools. 40 schools, public and parochial we cover, but most of them are public, 33 of them are public. I have 23,000 students in the city of Waterbury. I manage 40 health rooms. We're very lucky also. The mayor of the city of Waterbury has supported me in the last 10 years, and I do have a nurse in every school every day in RN. So I'm very lucky that way, but it took a lot of convincing. Oftentimes I go to these, Board of Education meetings and meetings of governmental people, and really I've spent a lot of time educating them to the type of student we do have in our schools in the city of Waterbury. The city of Waterbury is a population of about 110,000 people. As I said, I have 23,000 students, and it is the population is very needy. The children in my school district have just very, very high social economic needs. So in the past few years, I've been thinking, what can we do? What can we do better? What can we do to reach our audience? The project started 2.5 years ago when I researched and did, which you'll see part of, and you can look at some point on my website, a history of school nursing in the city of Waterbury. I did the research, and it was just amazing to me. The city of Waterbury has been innovative in our specialty since 1914. In 1914, we had 7 school nurses who were already operating in the city of Waterbury. And they did all kinds of innovative things, like they would do home visits. Okay, well, that was going on a lot back then. But we had a very high, at that time, poor immigrant population. And a lot of the schools, my school buildings, there's 6 of them that were built in 1925, were equipped with bathtubs and showers, because what was happening is the school nurses, because the immigrant population was so needy that the children were coming to school not clean, all kinds of infectious diseases, 15, 20 immigrant family members in one little 3-room apartment, and the school nurses would bathe the kids in school on a couple of days a week. And they'd take turns, and the school nurses would go to the different groups. There weren't 40 schools then. Would go around and bathe the nurses. We also had a pediatrician whose name was Dr. Monaghan, and his sister, Minnie Monaghan, was our first school nurse. And they would go around in the horse and buggy and visit homes when it was necessary. And it's interesting because a lot of the things that they dealt with then, we're still dealing with. We still have these issues and problems. It's amazing to me. So it inspired me to think about, how can we do things better? How do I reach my population? Because I struggle all the time, and even with my staff of, 65 nurses, including per diems, and 17 public health aides, they all kind of look like me, and it's like, some of the comments our speaker was making before, it doesn't matter what we think. It doesn't matter how we raised our kids. It doesn't matter that we always had our physicals in no matter what. That really has nothing to do with my population today. So I kept thinking, you know, everything I'm doing isn't working. The conventional methods of communications, notes in the backpack, the school newsletter that was sent home in English, the phone calls, well, you know, we get these cell phone numbers at the beginning of the school year, and I mean, they're all disconnected. I mean, even when we're trying to send sick kids home, I don't know if I'm the only one in the room that has this issue, but I mean, we can't get parents. The cell phones don't work, they've been disconnected. I have a hugely high transient population. So I sometimes will look at a chart, and I will have a child in the first grade in Waterbuty who has already moved 14 times. So even the rosters and the addresses and all this stuff, none of that is helpful I mean, sometimes it is, but you know what I mean. Generally speaking, it doesn't help us that much. And my nurses, when we get together, that's always the things that come up, you know. And so we even have sent certified letters. Well, what good does that do if the people moved 4 times since I sent the letter, you know? So, I mean, I'm someone who, I don't know what kind of level person I am, but probably one of these high, whatever she was talking about. But, you know, I'm a person that's always wanting to do better, to do more, to improve things. And I said, you know, we've got to take some of the brunt of this responsibility. I mean, who are we, and why should we all keep expecting the parents in my school district to do things the way we've done it? It doesn't work. I mean, clearly it didn't work. So with the support of my health directors, I decided to become contemporary in communication. So what that meant is adjusting our ways of communication to our audience's ways of communication, and expecting them to not to communicate the way I wanted it, but the way they do communicate. So what do I know? Well, I know that most of our moms are young. They all walk around with cell phones. They love Facebook. They love all that kind of stuff. And we weren't utilizing it all in school, nursing. So I thought about my peers in 1914 and how they inspired me, and I thought, you know what, we just have to make a change here. And I mean, believe me, it has been painful, the change, because I mean, like I always say, my other specialty was labor and delivery. I could deliver a baby on this floor right here, and I have. But this, now trying to navigate these laptops and all this stuff, is just so anxiety producing. But you know, I had to get over it. So we started out by, now, wait a minute now. And if I do anything, you know, bear with me, because this is a whole different laptop than the one I'm used to, right? So, if you look at what's up, you can see that we have our own school nursing website in the city of Waterbury. So, if you guys, any of you girls want to look at it after, and I'm hoping to inspire others maybe to start something like this, if you, on whatever level. It really doesn't cost a lot of money. That's the other great thing. It doesn't cost much money to do this. So it's www.waterburyct.org/school nursing. So I decided to create this, but we started slow. I started like a year and a half ago, and the first thing I did was I went on Facebook, and I thought I was all in with that. I went on the Facebook, and I started last June by creating posters, you know, posters like 8 by 11, but then you take a picture and you put it on Facebook, and it was like a countdown from June to the first day of school, and they were really colorful things that I made, and each week on a Friday at 9 a.m., a new one comes up. And what was this poster telling the parents? It was saying, you know, make your appointments for your doctors now so your physicals will be ready for August, you know, all these kinds of things that we're always trying to tell them and trying to say, and you know, during the summer, we have beautiful city parks in Waterbury, you know, walk with your children, you know, just, so every Friday, I posted that. And lo and behold, the likes and the shares started pouring in. I mean, I was getting all these likes and shares, and it was from the parents, because you kind of can figure out who is, you know, liking and sharing and all that kind of stuff. And it became kind of funny in the city, because by the end of the summer, I was beating the cops and the mayor's office in likes and shares, okay? And I'm pretty competitive, so I'm still, but anyway, so if you look at what you're looking at on the screen now, is just a picture of all of us, actually, my motto as a school health manager when I mentor and impart to all of my employees is that our job is to simply have the school children in the city of Waterbury, have them be safe, healthy, and ready to learn. That's our job. Our job is to keep kids in school as much as possible, and to advocate for them, and to keep them so that they can be educated. I mean, that's why they're there. Now, if you're looking as I'm going up, you can see that first thing I put front and center, because this also is great when I go to all these meetings, and when I put this up, and people see what school nurses in Waterbury are actually doing. I mean, I'll bring you to like, for example, in 2016, 2017, we had 189,658 visits to my 40 school health rooms. And we returned, which I'm most proud of, 178,000 kids to the classroom. So what that means is that, you know, we saw all those kids, and we got most of them back to class so they can be safe, healthy, and ready to learn, which is our goal. But if you see this in print, these statistics, when I show these to anybody but us, because we all know this is what we do, it's impressive. You know, just the fact that, let's see, I'll point out one more. Oh, daily medication. So we give like 30,000 daily medications in the city of Waterbury for the nurses. And then you have teachers who, you know, if they have 23 kids in their class, it's like, wow, you know what I'm saying? I can say this kind of stuff because we're all nurses. But you know, blood glucose testing, 18,000 times we had to test kids. And I'm sure you guys, depending on the size of your school system, have numbers like this too, or, you know, within your, you know, I have 23,000 kids, I'm sure you have less, but no matter what, they're impressive numbers. So that's front and center, because it also has educated the parents. They really had no idea either that all this goes on in school, and that this is what school nurses do. And so I'm always trying to educate everybody to school nursing. It's my passion, and to how important we are in what we do. Now, this year, my goal for my school nurses was, we focused in on asthma this year, because we have a huge amount of children in the city of Waterbury with asthma. Actually, we have 4,332 students in Waterbury with a diagnosis of asthma. It's a major problem for us. It's also very much so a lot of environmental triggers. Our housing, our stock in the city of Waterbury is mostly built before 1978. You know, we have a lot of lead issues, but we just have mold, and I mean, there's just so many reasons. People, again, a lot of people in a smaller amount of places, just like 100 years ago, right? And they have animals and pet dander, and of course, we have a lot of citizens who still smoke. So all of these things, these are the homes my children are coming from, and obviously we have a lot of kids with asthma. So, one of the things that we did this year is my nurses, I had them educated to the Putting on Airs program, and we have in the City of Waterbury Department of Public Health. We manage the Putting on Airs program for Waterbury and 5 or 8 or 9, how many towns? I think 8 or 9 other towns. My assistant who's here today is actually the grant manager for asthma. His name is Nick Palermo, and he's in the back videoing me. But he is the one who manages the Putting on Air program for us. So our nurses, we educated them to that, and all of a sudden they started. I mean, I love this because it was like you're able to see immediate results, which I love. I'm like, not this in 10 years from now, you know, something's going to happen. My nurses already gave him like 55 referrals to his program in the last school year. So you have 55 kids who, and how did they do it? Because they had the asthma action plans. They know who in their school is mild, moderate, or severe. Of course, we go after the severe cases first. And they talk to the parents. And they then referred them to the program. And the program is a pretty awesome program. It doesn't cost them any money. But you get 3 visits with a respiratory therapist and nurse to your home. They can do a visit to evaluate the house and maybe some of the things there that are contributing to this, and they educate both the parents and the child, and you know how many times have you had inhalers brought in? It's the brothers, it's the uncles, it's to the importance of this, because let's face it, do you think these parents really get that much time with the doctor explaining all this? I mean, we know that doesn't happen. So it's another way to get our kids to stay in school more, because you know it's the #1 chronic illness for kids, and they miss a lot of school because of it. So that's one of the things we did. And actually, we also, my school nurses, and it's here, we also had Connecticut Children's come at the beginning of the school year, and I had them certified in the Easy Breathing program. So that's what my goal for this year was, to focus on that chronic illness. And you can see all the things about that. And by the way, both those programs could be available to any of you to utilize as nursing supervisors, to bring them in to train your nurses. And it tells you, it says that all the information's on the website, how to get to the program and all that. I want to share with everybody, so I'm not only educating the city that I work within, the parents, the kids themselves, but anybody else who looks at the website. We also have a school children's childhood immunization program, which I also run that. It's once a week on a Monday at the health department, and that's basically to get children who are arriving new to the city into school as quickly as possible and get their immunizations up to date. I mean, we still struggle with that. We still struggle with, but it has improved because I've gotten more physicals and more kids immunized because the parents have seen it on the website. They can also, as we go through this, they can download and print any of the forms that are necessary. Like the 5 major forms are on here. So it doesn't have to be crumpled in the backpack or this, that, and the other thing. If they work or they have the availability, they can print them themselves. They can bring them to their doctors. And we in Waterbury are taking a huge step this year because we have 4,332 kids with asthma. I have orders for 1,840 inhalers on board today in school. And we only have 128 asthma action plans. And we are biting the bullet. I have the support of the health director, my medical advisor, the mayor, and August 27th, the first day of school, if any of the providers, the doctor, whoever they are, sends in orders for inhalers that are not on the asthma action plans, they're being faxed right back. And we will not take these orders unless they're on asthma action plans. That's going to be our policy in the city of Waterbury. So, I mean, if providers want their patients taken care of, they're going to have to do it. I mean, at some point, you have to bite the bullet. Now, it's probably going to be a war, but we're trying. So Are you all familiar with asthma action plans, right? So do you get a lot of them, or? So what the beauty of it is, and I've been, I've spoken to the CEOs of both hospitals, because I don't know about, but in Waterbury, most of the pediatricians are now working for the hospitals. Like, we have very few private practice people anymore. So I got to the two CEOs, told them, and I said, you need to tell your doctors they need to do this. See, now they have a boss, actually, which is the CEOs. And so both of them are saying to me, Lois, we'll do it. My husband always says, they just want to shut you up. But, if it works, it works. So actually, that's what's going to happen. We are not going to accept inhaler orders, at the beginning of the school year without the asthma action plan. Because the asthma action plan helps all of us. It gives us a snapshot of the disease. It's just not a paper that says, if the child is wheezing, whatever, 4 hours, 2 puffs, and that's it. I mean, it tells us the other medications they're supposed to take at home. It tells us how bad their asthma is. It tells us about a lot of important things, and they're on here. Let's see. The other thing that I did was, as I'm moving down here, you see that I put up the PreK early childhood health assessment, the grades 6 and 10, because that's our grade, and the immunization requirements for the students. So it's all there for the doctors, for anybody, because we still struggle with this. Every month, all 40 of my nurses, all 40 schools, we send the kids who still are not up to date with their immunizations and their physicals, we send it right to the superintendent, because they're the ones who are supposed to exclude. They don't exclude them, we're doing our job, and that's why we've backed everything up, so no one can say, I didn't know, who knew, we knew, all this stuff. It's all right here on the website for anybody who wants to look at it, including providers. Now, if you look, hold on a minute. I just wanted to show you at the beginning, let's see if I can do it on this computer now. So, okay, so we're also on YouTube and all that stuff. So, alright. So just for an example, these are different YouTube videos that I've made and we know the parents are listening, they're telling our nurses, they see them, and you can tell, when they view them. So I'll just show you this one, for example. And I try to address problems that we continue to have with parent cooperation. Hello, my name is Lois Mulhern. I am an RN BSN, and I am the school health manager in the city of Waterbury, Department of Public Health in Waterbury, Connecticut. I'd like to talk to you today about some guidelines for you to consider when your child is ill. If your child is ill, they should not come to school if they have a fever above 100.4, if they are throwing up, if they have diarrhea or a sore throat. And by the way, your child should not come back to school until they have been fever or diarrhea free for at least 24 hours without medication. I hope this helps. So,
Hi, this is Ms. Tracy from Mulhern High School with some Halloween safety tips.
I also have gotten, my nurses have gotten into it. So once I did the first 6 or 7, I said to them in the meeting, you girls like
to see you and to stay on the sidewalks. If you do need to cross the street, make sure that you look both ways before entering the road. And that's your Halloween safety tip. Happy Halloween.
So,
I'm Lois from Nurse at Kennedy High School, and we're just going to talk about the crutch policy. So if your child is on crutches, you would need to bring your child in with a doctor's note stating what the recommendations are and the restrictions are for your child to be in school. We will alert the teachers to let them know that your child is on crutches. Your child will be given an elevator pass and notes to the teachers that your child is to leave class a few minutes early to avoid the rush and the commotion of the hallways. In the event of an evacuation, your child will be instructed as to where to go and when and with who. Your child will be able to have a friend with them to assist with carrying their books, and just one friend only though. And with the dismissals from class, the student may also have their friend go with them to their next class. Hopefully that child will be in the same class with them. And when it comes to the busing situation, if your child takes the city bus, if your child takes the bus with the school system, they will not be allowed on the regular bus. You will need to contact the bus department, and they will have to be put on a special bus that will accommodate the crutches. And if you have any questions, certainly feel free to call. Thank you.
So I think it's really cool that, what I learned was, I started it, I role modeled.
As the new sports season starts,
How do I shut this thing off? I thought I pushed the right button. Oh, okay. Sorry, see how I panicked? Anyway, what I think one of the most important messages too is that, my nurses, this is not, we did not think we were gonna be computer experts when we all started out. I don't think most of us are, I have a few young nurses who are like, James, it's about time. I don't have that many, so it's been tough, but you see, 5 minutes, okay. It's been tough, but you see, what I did was pick the 15 topics that are always, like lights and, the stuff that bugs us all. and we made the videos, but I did the first couple. Then I said, gee, and I was surprised, like 7 or 8 who said they would do it, and now I have more and more. And you can tell they're a little nervous, kind of, because it's not something we do. But I got to tell you, the response. The parents are like coming into like that nurse, for example, she's a high school nurse. She got so many likes, and because they also like to see their own nurse, whether it's the kids or the parents of that group. So I've noticed that really by bringing in the different nurses from the different schools, whether it's I have PreK, I have K, I take the weight, I have high school, middle school, all that, that you can get those messages out there. So, anyway, so that's it. That was. Does anybody have any questions?
Do you have any district issues in terms of going public like this?
No, because, see, that's what I said at the beginning. I work for the Department of Public Health. Education, the City of Waterbury Education Department is their own department, but of course, everybody works for the city. But because I got the support, I didn't need their permission. I don't need education's permission or anybody's permission. We, as a health department, this was an initiative, and there's nothing that we're saying or doing that isn't, of course, we follow the laws. So the answer is no, I had no problems. But you guys could take this to whoever you want and say, hey, look what they're doing,
Since you put all the, can we link to you from our schools? I have a very small district.
No, all you have to, this is a website.
Right, I just wanted permission.
No, my God, it's public, what did I say? www.waterburyct.org/school nursing. Yes, and you know what I even did now? you could go on, I had the tech people do this. I give them the ideas, but I don't know how to. I asked them now, you can Google or Bing just Waterbury School Nursing and it'll come up. So yes, please, I'd love to share.
So I think afterwards you can absolutely connect with Lois. But when Lois talked to me about this, you can see why I asked her to please come and share. How fabulous is this? So Lois, I just want to thank you. And this is a wonderful. These are some of an example of just the wonderful things that school nurse supervisors and school nurses are involved in. And so, I'm just so proud of the work that you all do. So at this time,